Okay. Hi everyone, our presentation is on Amish culture and how nurses should care for Amish individuals. The people presenting are Paige Mott,
Haley Burney,
Kelsey Goodkind,
Megan Hargraves, Emily Wikes,
Eden Hessinger. To start, we chose this cultural group because I grew up in Bucks County, Pennsylvania, which is about an hour and a half away from Lancaster, which is one of the largest communities of Amish people in the world. As of June 2022, it is estimated that 370,000 Amish people live in North America. 92% of Amish individuals live in Pennsylvania, Ohio, and Indiana. In Florida, in Pinecrest, Florida, near Sarasota, there are 100 Amish residents that live there permanently. Now I'm going to start talking about the Amish values. The Amish have a simple, self-sustaining way of life that rejects modernization and values traditional living. They follow a code of conduct called the Ordnung, which means order, discipline, rule, arrangement, organization, and system. Amish people value modesty and equality, and this is showcased especially in their attire. They wear solid-colored, plain, modest clothing to promote equality between everyone. According to the Amish, it is a biblical command that women must cover their heads while praying. Therefore, women always wear prayer caps because they always must be ready to pray. Men grow their beards out once they get married. Amish individuals value a simple, traditional life and therefore do not use electricity and travel by horse and buggy. They're also not allowed to travel far away from their homes. And the Amish people believe that the church is not a building, but instead a group of individuals. Therefore, they do not have churches and instead practice and have service within their homes.
So now I'm going to discuss the uniqueness of Amish culture. So Amish culture is rooted in the belief of titular patriarchy. This belief is based on 1 Corinthians 11:3, which says, "But I want you to understand that the head of every man is Christ, and the head of a wife is her husband, and the head of Christ is God." The Amish believe that the husband is the head of the household, and in public, he will make decisions for the family. In private, it is common to see a husband and wife making decisions together regarding management of the house and the farm and discipline. In Amish culture, it is common to see men doing farm work and women managing the household chores such as food and clothing production. Another unique aspect of Amish culture is how their names represent where they are from and who they are related to. When children are introducing themselves in public, they will say their father's first name, so whoever they are introducing themselves to will understand who their father and mother are and where they're from geographically. Depending on where an Amish family lives, there will be separated into a church district along with 30 to 50 other families, and the church community will choose its own leader, who is typically a preacher, a deacon, a bishop, and they're always male.
So it's important to note that there are many health disparities within the Amish community. One of the biggest ones is that the Amish are uninsured. So this references their ability to manage their health coverage, and they also do not receive Social Security, which is in reference to the biblical beliefs about helping one another. This can be problematic, though, because they are at a disadvantage for paying their medical bills or health care in general, especially after working many years. If there are any health issues present, the Amish access to healthcare is very limited. This can relate back to the issue of lack of insurance or financial issues that may occur because healthcare is so costly in the United States. They may decide to forego treatments and many other routes. Not to mention they are limited physically due to slow transportation. The Amish are also at a disadvantage primarily with their ability to obtain information. Often they lack the proper knowledge and resources to perform screenings for genetic disorders, and most of the time aren't educated enough on understanding their burden of higher incidences of genetic disorders. In the scopes of their chosen practice, they reject prenatal care, immunization, and preventative measures of conception that can cause a major health care gap. The only measures they have taken prenatally is confirming pregnancy and may have check-ins periodically. To note their immunizations, there is no rule against immunizations within the Amish community. However, it's a chosen practice for avoidance of immunizations, with only 16 to 26% of Amish children that have been vaccinated. In relation to birth control, the Amish do not practice birth control even if pregnancy is life-threatening, and 100% oppose abortion. Some primary nursing concerns that should be applied to treating a patient within the Amish culture heavily relates to the beginning of the procedure by introducing yourself as the provider. As a nurse, you should address your own personal biases and opinions and then begin to educate on the Amish customs and prohibitions. Identifying endemic conditions and health disparities within this cultural group will allow for the nurses to prepare conversations, preventative talks, or treatment plans according to what best fits the Amish culture. With their education, a nurse should approach the patient understanding that they are high context culture and they may have language barriers. In this case, an interpreter is necessary to give optimal care.
So now we're going to specifically just focus on the Amish beliefs that are driving these decisions of whether they reject certain practices and what we'll be considering as nurses. So as we stated, the church is in the house. They don't have a separate building. They gather as a community and is the group of people that is considered the church. So that group believes that God is of will. He is responsible for all things that they do when it comes to them suffering from an illness. So healing intervention is pretty much his choice. They believe that they are at his will. So any kind of healing interventions might be a little more resisted in a hospital setting. This also causes patients to not really trust the modern medicine and more trust in God's will to act. So illness is sort of a failure of function in the Amish workforce. So as soon as the illness is really they're tackling that illness, they're not really as useful, whether it's the woman that is in the household, responsible for gathering food and also clothing. But if a man becomes ill, he's also not able to work in the farm and with animals and gathering crops. So that being said, it also can probably cause a lot of hostility in those family units because they don't think of it as just an act of God, but it also is a burden on their role in the household. So that being said, considering that God is at will, life extension measures might be rejected. For instance, DNR, so that will be something, do not resuscitate, so that will be something that is likely to be on a Amish patient's order. So now we'll continue with a sort of alternative, since these people will be a little more likely to be skeptical about modern medicine. They do prefer complementary and alternative medicine, or CAM methods. These methods can be massages, they can be herbal teas, anywhere from like spiritual practice is considered CAM methods. And this is like the percentages are definitely prove to be a more preferable way to have them practice in the hospital to heal in their preferred method. So modern medicine, only time it's really preferred other than obviously in extreme trauma circumstances is obstetrics. So during natural births, they'll probably be transported to a local hospital if there's something that might be a little more risky. And for burn victims, that's another thing. They actually have a leaf treatment and a BW oil ointment that they prefer instead of skin grafting, which is, I think, a little interesting and unique in the Amish culture. And as far as the Social Security, and considering they're sort of removed from the American economics of all of it, that's one thing. They are not able to afford a lot of American health care. That's the alternatives, and I'll pass it on to Eden.
All right, so I'm just going into the diseases, conditions, and genetic issues that typically affect the Amish population. So the most common are dwarfism, which is just a syndrome that leads to short stature. We've all heard of that. And from dwarfism, also cartilage hair hypoplasia. So people who have dwarfism will also have this. It's just extremely fine, silky hair. There's some blood disorders such as Wilbrand disease, hemophilia B, so these are all just blood clotting factor diseases. We also have Ellis-Van Creveld syndrome, which is just a genetic disorder which restricts bone growth, and then Cohen syndrome, which causes diminished muscle tone as well. And lastly, we have pyruvate kinase deficiency. So that's just an enzyme deficiency that affects energy production in red blood cells. That's the one that I chose to delve into further. So from Glatter and al., they describe pyruvate kinase deficiency as a deficiency that impairs glucose metabolism, resulting in inadequate ATP production by red blood cells. So in these severely affected red blood cells, they reduce the levels of ATP, which leads to cell injury, a loss of membrane plasticity, and the formation of rigid red blood cells, which then are destroyed in the spleen and the liver. This leads to the hemolytic anemia, so all the red blood cells become destroyed. So the way this impacts a person's life is that it makes it very difficult for them to participate in any type of physical activity, and it also leads to greater risk for osteopenia. So they have higher bone injury. So the way that they were to cure this is for, first and foremost, it's transfusions. This is probably the most common one. This isn't really a cure, but it does keep the symptoms at bay. It's more successful in the early years of life, just so these patients can undergo normal development. But however, there are no standards for these transfusions because the severity of anemia varies from each patient that has pyruvate kinase deficiency. There's also a splenectomy, which can be successful because the hemolysis occurs in the spleen, but there's usually a poor response if these patients have received transfusion treatment in the past. And then also from the splenectomy, there is increased risk for sepsis and thrombosis, which just puts them more at risk. Folic acid is also very common because it helps to increase erythrocyte production. It's the most important, especially for those patients that have less severe cases of pyruvate kinase deficiency. And lastly, it's the hematopoietic stem cell transplant. So this is the only really known cure for pyruvate kinase deficiency, and it's especially successful in younger patients, but it's quite controversial because the criteria for these patients to receive this transplant, we're not really sure of it yet. So more research needs to be obtained before it's recommended. And pyruvate kinase just leads to the symptoms that we've seen in pathophysiology from the chronic hemolytic anemia, such as fatigue, fainting, weakness, shortness of breath, pallor, jaundice, hypotension, palpitations, and headaches. And now Emily.
Okay, so now on to caring for the Amish. The first aspect of care that I would do is provide education. And to do this, I would use educational brochures and informational videos because the Amish typically only get up to a middle school education. Some of them do receive a high school education, but not all. I would also use a translator for Pennsylvania Dutch because this is what most Amish people speak, is a combination of German and English. So if they don't speak English, I'll bring in a translator. The next thing I would do for caring is promoting wellness. And to promote wellness, I would speak with the husband or the father figure in the family regarding any health decisions because they view the male figure in the Amish family as the main decision maker. I would also consider their belief in the Old Order Amish Mennonite Church, which they follow, and their strict adherence to the Ordnung, which is their religious text. This is how they make all of their decisions before the father figure. And then for care, again, we're moving on to preventing disease and overcoming barriers. To do this, I would educate the patient regarding immunizations because the Amish typically don't get immunizations, but these are important because they live in the country. I would also inform them how disease spreads in communities because they live in communities in the countries. I would also discuss alternatives that abide by their beliefs and their ability to provide. For example, birth control because they typically don't believe in it, so I would provide an alternative to that. caretakers, high prices because they don't have insurance, and etc.